the most desperate situation for children is beyond Kabul. And while the world for a moment focused on Kabul, the truth is what's happening in the rural areas and other provinces is really concerning. So recently I was in Herat with our team there, which is really at the western edge of Afghanistan, in an area that has been impacted by drought as well. So as also the colleagues have mentioned, and this is a buildup of a series of almost crises. These are children who have been impacted by drought, by COVID-19. Schools have been closed for a very long time. We have already seen a dip in the numbers of vaccinations already before the situation changed. And now, as the health system is crumbling, we are really concerned about this. So just to give you an example of what was happening in Herat, what we saw, as Catherine mentioned, the pressure on hospitals is increasing as primary and secondary health facilities aren't able to provide the services they used to. The families are having to come to the regional hospitals. And when we went to the malnutrition ward at the Herat Regional Hospital, we saw exactly what Catherine was talking about. It is a ward that can take 60 children. There were 90 children in it, most of them being treated for severe acute malnutrition with complications. And the nurses were telling us that they get more children every day. And frankly, the nurses and the health workers there, they're basically angels at the moment. They are working in a system that is not able to pay them salaries, or for example, for the nurses, because they don't feel fully safe, they're organizing themselves in longer shifts. So they stay for 24 hours or sometimes 2 days, and then they go back home for a couple of days, and then they can come back to keep these systems going. So if we are not providing these treatments, vital treatments, these are overstretched systems that you have at the moment there. The same with all the various social services. They are very stretched when you go out of the central areas. In Herat, there is also quite a large area where families since 3 years ago, because of drought and conflict, have congregated. So it's almost a little town on the edge of Herat city. And over there, you have, when we went and we were talking to the families, we have the UNICEF facilities were functioning. It was amazing to see the community-based education tents operational. It was amazing to see the child-friendly spaces operational. These little white tents in the middle of big, almost small town of mud buildings, and you have these white tents everywhere. It's truly inspiring. But the truth is, when you go and talk to the parents, the situation now is beyond just an issue of health or access to education. With the collapse of the economy and the lack of access to income, families are literally hungry. So you have about, WFP says 14 million food insecure people around the country. But literally what that means is there is a meal a day or maybe two, and the meal is dry old bread that they dip into tea. That is what children have before they come into the education tent or the child-friendly space tent. When I talked to one of the parents, they were asking how can we help with incomes? Is there a way to? And I asked how they're managing. There is no work really to begin. It's an area that's been impacted with drought. Most of them are farmers, so there isn't really any income. What is available is to send out children to collect plastic that they can sell, to buy the bread that then they eat with tea. The amount of pressure on families at the moment is really mounting. What is interesting also is this is not only now impacting the people who are already with lower income, but as we see restrictions on access to cash at the moment, people have access to what's equivalent of $200 a week. with no income, we are seeing even families who are a little bit better off struggling to make sure that there is enough food on the table. And this is a cycle that impacts a lot. I mean, in the Herat hospital, I met a lot of mothers. I mean, many of them are very young. And one of them had a child who was thankfully recovering through treatment for severe acute malnutrition. But when I was wondering, is this a first child that is impacted like this? She told me yes, and this is her third child, but this is the first one she's bringing to the clinic, because she said, we have no food anymore. They had sold the cattle. There is very little income. She's not eating well. And she said, I have no milk to feed my baby. I have no breast milk to feed my baby. And at that point, she brought her child, Amina, to hospital, and she was getting treatment. So there is a cycle now that is putting more pressure on families, increasingly children. It also means that they are more exposed to child labor and possibilities of going to school. The issue around education obviously is concerning, because you still have, as Manuel said, around 4 million children who are out of school. Now, in all of the provinces, children in primary school are going back, and it's amazing to see them all, and they still get the UNICEF bags as they go to school, and it makes you very glad to see that. But of course, in many provinces, adolescent girls are not going to school, and that is a concern. Now, the picture in Afghanistan is not everywhere the same. So we have, for example, 5 provinces where we know that there are adolescent girls going to school, and that is encouraging for us. We have, for example, in the eastern region, there was an announcement that said, called for all female workers in the health sector and also in education to come back to work. And within these openings, our colleagues in the field, whenever the door opens, they go in and they find opportunities. For example, in the northern region, the discussion around a broader measles vaccination campaign happened at a province level, and they were able to get approvals from these provinces to start a campaign. So it is a very complex picture, and wherever our colleagues in the field, wherever UNICEF finds a door that is opening, we will find a way to go in. We see the same happening in Kandahar with polio vaccinations. We see the same happening, as I said, with education, with other campaigns. So that picture that is very varied is at the moment the way we can make sure that we still reach where we can. I want to go back to the mention of the health facilities, and Manuel mentioned about 2,000 health facilities closing down. Now, the way that while the world figures out, and us, the UN agencies and UNICEF figure out how this comes back to work, what we are doing is we are increasing the number of mobile health teams in the field. And that is what is sort of making sure that in the furthest areas that we reach. At the moment, we have 60 that are moving around. We're scaling up to around 100. And again, with these teams, when you meet them, it's amazing. They're still doing polio vaccinations. They're still doing malnutrition screenings. And we have, female and women and men doctors there in these teams working, and it's encouraging, and it's something that we can actively do to keep the systems, or at least the children, alive, basically, while the broader systems are coming back online. Because as has been mentioned, this is not a crisis, unfortunately, that will last short. This looks like something that the world needs to keep its attention on. At the moment, we have, as Manuel mentioned, some of the flights are coming in, so we have increased number of colleagues. All our offices are now open. And in places like Herat, for example, our amazing female colleagues, national female colleagues are back in the office. They are in the field. When I was there, it was my colleague Kadira who was with us in the nutrition center, and also the same when we were with child protection activities and facilities. So slowly, we are coming back into capacity. Are we fully there where we need to be? No, because the needs are humongous. And as we are now having access to areas that we didn't have before, that used to be under Taliban, we will see more and more need. And of course, we will have to expand our reach. So it is really, as Catherine was saying, something that we call out to you to continue supporting us, to be able to reach every child, as we always promised. And I find that image of, you know, the UNICEF tents in that big IDP settlement, where wherever you're walking and you hear the sounds of children learning or children laughing or the sound of a child crying because they're getting a needle for their vaccination, that is hope. And as long as we can deliver hope at the moment, because it can be terribly dark for a parent at the moment. And as long as we can deliver this hope to children and to mothers, I think we should and we must, and we're here to do it.